it has certain boundaries. Like the base is formed by inguinal ligament. The base is formed by inguinal ligament. In this diagram, you can see that inguinal ligament, this white line, this one where I am focusing the cursor. The base is formed by inguinal ligament. Like that, it has a medial boundary and lateral as well as an apex. Because it is a triangular space, it will be having an apex and a base. Apex will be pointed whereas base will be broad. Base is formed by the inguinal ligament in the upper part. This is the inguinal ligament where I am focusing the cursor. Like that. The lateral boundary is formed by a big muscle called sartorius. The lateral boundary of femoral triangle is bounded by medial border of sartorius. Like that. Coming to the medial border. The medial border of this femoral triangle is bounded by medial border of adductor longus. Again, I am repeating the boundaries. Because it is a triangular space, it has an apex which is pointed, a base which is broader. Like that, a medial boundary and a lateral. The base is formed by inguinal ligament in the upper part. There is a lateral boundary is formed by medial border of sartorius. And the medial boundary is formed by medial border of adductor longus. Now coming to the apex. Apex is a point where these medial boundary and lateral boundary are meeting. This is where I am focusing the cursor. It is the apex. And this apex, it continues, the apex of the femoral triangle, it continues downwards as the adductor canal or subsartorial canal or Hunter's canal, which is seen below the sartorius. So the name subsartorial canal or Hunter's canal or this adductor canal. So regarding the boundaries of femoral triangle, is it clear? Regarding the boundaries of femoral triangle, is it clear? So what are the boundaries forming this femoral triangle? Anyone? Can anyone answer this? What are the boundaries of femoral triangle?
Base is formed by inguinal ligament, lateral
Right.
boundary by medial border of the sartorius, medial boundary by the border of the adductor longus, and the apex is by the joining of the medial boundary and the lateral boundary. The apex continues as the sartorius canal or Hunter's canal.
Okay, good. Now, this femoral triangle has a roof as well as a floor. Now, we'll see about the roof. This femoral triangle has a roof as well as a floor. First, we are seeing the roof. Roof is formed by the superficial fascia as well as the deep fascia and skin in this region. Like coming from outer to inner, skin, superficial fascia and deep fascia. The deep fascia in this thigh region, upper thigh region, it is also called as fascia lata. It is also called as fascia lata. Next, in this diagram, can you see a small opening over here where I am focusing the cursor? Where a vein is entering through this opening. It is called as cribriform fascia or Stephanus opening, which is seen in the upper part of this femoral triangle, where the Stephanus vein enters into this femoral vein. So, regarding the roof is formed by skin, superficial fascia, and deep fascia. The deep fascia in this region is also called as fascia lata. Coming to the floor. Floor of this femoral triangle is mainly formed by four muscles. Like coming from medial to lateral aspect, these muscles are in this diagram. You can see them. One is the adductor longus, which is formed in the boundary of this femoral triangle. Along with the adductor longus, next muscle is the pectineus. Here where I am focusing the cursor. After that is psoas major and iliacus. So the floor of the femoral triangle is mainly formed by four muscles. Medially two and laterally two. The medial two are adductor longus itself and pectineus, whereas the lateral two are psoas major and iliacus. I'll show you these muscles clearly in another diagram. Here you can see them. This is the femoral triangle. The boundaries of femoral triangle, like this muscle is the sartorius and this is the adductor longus. You can clearly see both of them. Like that you can see the inguinal ligament also over here. So I think everyone can clearly see these three things: inguinal ligament, sartorius and adductor longus in this. Now, the floor muscles are also clearly visible. See them where I am focusing the cursor. These are the floor muscles. Medially you will see two muscles and laterally you will see two muscles. They are also clearly visible in this diagram. The medial two are adductor longus and pectineus, whereas the lateral two are psoas major and iliacus. All these four muscles are clearly visible in this diagram. So, again, how the roof and floor of this femoral triangle are anyone. How the roof and floor of this femoral triangle are formed. Anyone? Already I've shown you the diagram. Roof is formed by skin, superficial fascia and deep fascia. And here you will see an opening in the superficial fascia, which is called as cribriform fascia, saphenous opening, through which the saphenous vein enters into the femur. Coming to the floor, floor is formed mainly by four muscles. What are they?
Adductor longus,
Right, adductor longus, pectineus, psoas major and iliacus. All those four muscles, they are clearly visible in this diagram. I think everyone can see those four muscles also, which are forming the floor of this femoral triangle. And even you can see the boundaries also, sartorius as well as adductor longus and inguinal ligament over here. Now, this is a line diagram which you can practice while reading, so that entire answer of this, the answer of the boundaries as well as the floor is clearly seen in this diagram. A very simple diagram. I think everyone can practice this diagram. Like see the boundaries, they are clearly shown over here, sartorius, like that this adductor longus, inguinal ligament, which is forming the base of this triangle, like that the apex is formed by the meeting point of this adductor longus as well as the sartorius over here. And the floor four muscles are clearly seen: the adductor longus, pectineus, psoas major and iliacus. They are clearly shown over here. So in exam you have to draw this diagram showing the boundaries as well as the floor of this femoral triangle. Now we will see the details of these muscles which are seen in this area. Like first we will see about the inguinal ligament. See, observe the inguinal ligament over here. Inguinal ligament is forming the base of this triangle and it is broader when compared with the apex of the femoral triangle. And when you observe this inguinal ligament, it is extending between the anterior superior iliac spine and the pubic tubercle. I'll show you that also. Now, this inguinal ligament, there is another name for this inguinal ligament. It is also called as Oppert's ligament. This inguinal ligament is a short answer. It is asked as a 3 marks question. So better you take a screenshot of this slide as well as the next slide. There regarding the inguinal ligament. The answer is there in this. This inguinal ligament is also called as Popper's ligament. Sometimes in exam they may ask like this also Popper's ligament. Don't get confused. It is nothing but simple inguinal. We'll see how it is formed. Regarding the formation of this inguinal ligament, there is a muscle in the abdomen called as external oblique. In the lower part, it has an aponeurosis. So the external oblique aponeurosis. That means the external oblique muscle in the lower part, it has aponeurosis. Now, the inferior border of this external oblique aponeurosis is thickened and folded on its inner side to form this inguinal ligament. I think, am I clear regarding these words? There is a muscle in the abdomen called as external oblique. In the lower part, this muscle has an aponeurosis. And in order to form this inguinal ligament in the lower part of this external oblique aponeurosis, it is thickened and it is folded on its inner side to form a ligament called the inguinal ligament. So this inguinal ligament, here in this diagram you can clearly see this inguinal ligament. Here you can clearly see it is extending between the anterior superior iliac spine here and pubic tubercle. This how it is formed? How this inguinal ligament is formed? Just now only I said there is a muscle in the abdomen called as external oblique. So in the lower part, it has an aponeurosis and it is thickened and it is folded on its inner side to form this inguinal ligament. It extends between the anterior superior iliac spine and the pubic tubercle. And here from the pubic tubercle, it is reflected and runs medially to form another ligament called as lacunar ligament. No. Am I clear regarding inguinal ligament? Someone say yes or no. Okay. People are messaging me with these thumbs saying that it is clear. Okay. Now, this inguinal ligament is asked as a 3 marks question. So you have to draw a rough diagram of this. And see, I have shown you this line diagram. This also can be helpful. You can draw a rough diagram over here, showing this anterior superior iliac spine as well as pubic tubercle and an extension between these two. And you can write it as inguinal ligament. So, after inguinal ligament, coming to the muscles, sartorius. This sartorius is a strap muscle, longest muscle and strap muscle. And the sartorius is seen in anterior compartment of the thigh. This sartorius is seen in the anterior compartment of thigh. One. Okay. And it runs obliquely through this thigh. And when you measure the sartorius, it is 45 centimeters in length. And again, in your university as well as in the practicals, there is a question. Structures measuring 45 centimeters in body. Can anyone say what are the structures measuring 45 centimeters in the body?
Thoracic.
Okay, thoracic duct, good.
Vast difference.
Vast difference, good.
Spinal femur. Spinal cord.
Spinal cord, good. Anything else? Femur, good. So it is It is a Viva question. Remember, structures measuring 45 centimeters in the body. They are the sartorius. Next, the bone which is present over there, the femur. Length of this vas deferens, thoracic duct, spinal cord. Next, length of the transverse collar. And distance from the incisor teeth to the cardiac end of the stomach. Am I clear? Distance from the incisor teeth to the cardiac end of the stomach. Even umbilical cord. So these are the structures which measure 45 centimeters in the body. It is a Viva question as well as a 3 marks question in the theory also. So coming to the origin and insertion of the sartorius. This sartorius, it arises from the anterior superior iliac spine. And some fibers arise from a notch below this anterior superior iliac spine. And regarding the insertion, these fibers, they run downwards and obliquely and close to the medial aspect of the thigh. Medial aspect of this knee joint, and is inserted into the upper part of subcutaneous medial surface of the shaft of the tibia. Regarding its nerve supply, supplied by nerve to sartorius, which is the branch of the anterior division of femoral. Regarding the actions of this muscle, mainly flexion and abduction at the lateral rotation at the hip joint. Like that, flexion and medial rotation at knee joint in semi-flexible position. After sartorius, coming to the next muscle, adductor longus. This adductor longus, here you can see this is the muscle, adductor longus. In the diagram you can see it. It is a triangular shaped muscle. Regarding the origin and insertion of this muscle, arises from a round tendon near the angle between pubic crest and pubic symphysis. And these fibers, they run downwards and are inserted into the medial lip of the linea aspera in middle third of the shaft of the femur. The fibers, they run downwards after taking the origin from this pubic crest and pubic symphysis. They run downwards and are inserted into the medial lip of the linea aspera in the middle third of the shaft of the femur. Regarding its nerve supply, supplied by the anterior division of operator adductor longus. Like that, coming to the actions. It belongs to the adductor. So, adduction and medial rotation of the hip joint and assists in flexion of the hip joint. So after adductor longus, coming to the pectineus muscle. This pectineus muscle is a quadrilateral muscle seen in the same plane with adductor longus. Coming to its origin and insertion, arises from the pecten pubis, which is just lateral to this pubic tubercle. And these fibers, they run downwards and are inserted into a vertical line near the lesser trochanter. And the linea aspera. So coming to this nerve supply, like this muscle is a composite muscle, so has a dual nerve supply. Like the anterior aspect is supplied by the femoral branch from the femoral nerve. Like that, the posterior aspect is supplied by the anterior division of this operator nerve. And sometimes this axillary operator nerve also supplies this. In this second diagram, you can clearly see this nerve supply. Like regarding the actions, flexion and adduction at the hip joint. So after this muscle, coming to the psoas major. This psoas major is a big muscle which is coming from the lumbar region and is inserting into the upper aspect of this thigh. This muscle belongs to the posterior abdominal wall also. Regarding its origins and insertion, like regarding the origin, it arises from the anterior surface and lower border of transverse processes of all lumbar vertebrae. It arises from the anterior surfaces and lower borders of transverse processes of all lumbar vertebrae. Along with that, it arises as a 5 fleshy slips. Here you can see them. The first one where I have focused the cursor, first, second, third, fourth, and fifth. 5 fleshy slips from bodies and intervertebral discs of lumbar vertebra. Like that, some fibers arise from the tendons which are arching or are bridging the sides of this lumbar vertebra. And all these fibers, they run downwards. They run downwards below the inguinal ligament, enters the upper thigh region, and is inserted into the tip of the lesser trochanter of the femur, along with this iliacus. Now coming to the nerve supply of this psoas major, supplied by ventral rami of L1 and L2 and L3. Coming to the actions of this psoas major. Like this muscle is a long muscle. Like when it is acting from the upper aspect, it is a chief flexor of the hip joint along with the iliacus. And when it is acting from the lower aspect, it flexes the trunk. And another thing is when the foot is lifted from the ground, it also acts as a lateral rotator of the hip joint. And when the foot is kept on the ground, it acts as a medial rotator of the hip joint. And another thing we have to remember is, like this psoas major along with iliacus, these two are the important muscles which are keeping our entire body or entire trunk in erect posture. If these two muscles are weaker, the erect posture of the trunk will not be maintained. Like, can anyone say what happens if these two muscles are weakened? How the posture of a person will be? You might have seen at your home also for in older peoples. How the posture will be if these two muscles, like iliacus and psoas major, are weakened. How the posture, usually erect posture is maintained mainly by these two muscles, along with the other muscles of the vertebral column. If these two muscles are weakened, how will be the posture? Anyone? I'm giving you a clue. Like you might have seen at home in older people, their posture will not be erect in older people. How it will be? Someone said whooping, 82 remember, not whooping, something else. Can anyone say? ఇంట్లో ఓల్డర్ పీపుల్ ఉంటారు కానీ ఇంట్లో మన తాతలు వాళ్ళు చూసుకుంటారు కదా. Like they will be flexed forwards or backwards. చూడండి గూను వచ్చిన వాళ్ళు ఉంటారు, బాగా ముందు పొంగిపోతారు ఓల్డర్ పీపుల్. It is like that. Now coming to the next muscle, iliacus. This iliacus is a triangular shaped muscle. Regarding its origin and insertion, it arises from the upper 2/3 of the iliac fossa. Here in the diagram you can see it arises from the upper 2/3 of the iliac fossa and this ventral sacroiliac ligament. Ventral sacroiliac ligament, which is present over here, and the ala of the sacrum. Regarding the insertion, these fibers, they run downwards, converge, and passes below the inguinal ligament, and is inserted into the lesser trochanter along with this psoas major muscle. Now coming to the nerve supply. Nerve supply is mainly from the branch of this femoral nerve. Regarding the actions, acting with psoas major, it is a chief flexor of the hip joint and assists in medial rotation of the hip joint. So these are the muscles and ligament which we are seeing in this femoral triangle. Now can anyone just give me a recap of what are the boundaries of this femoral triangle? What are the boundaries of this femoral triangle? So someone has to answer. Already I said it to you.
Base is formed by inguinal ligament.
Okay, base is formed by inguinal ligament. What about the medial boundary and lateral boundary?
Lateral boundary formed by medial border of sartorius muscle.
Okay. Medial boundary?
Medial border formed by medial border of adductor longus muscle.
Okay, good. After this, what about the apex?
Medial and lateral border.
Where this medial border and lateral border are meeting, that forms the apex and continues as
Adductor canal or
adductor canal or Hunter's canal or subsartorial canal, because that canal passes below the sartorius, so the name subsartorial canal. How roof is formed?
fascia, superficial fascia.
So roof is formed by superficial skin, superficial fascia and deep fascia. Now in this superficial fascia there is an opening object. What is the name of that opening? Cribriform fascia or
Saphenous opening.
cribriform opening or saphenous opening. Now, which structure passes through this opening?
Saphenous vein.
Saphenous vein. And it joins which vein? Femoral. It joins femoral vein. Next thing, what is the name given to the deep fascia at this area? Fascia lata. Fascia lata. Now, coming to the floor. How floor is formed? Floor is formed mainly by four muscles. Medially two and laterally two. What are the medial two muscles?
Adductor longus and pectineus.
Adductor longus and pectineus. Okay. Lateral two? Psoas major and
Iliacus.
iliacus. Okay. So these are the boundaries of the femoral triangle, and even I explained the muscles also. Now coming to the contents of this femoral triangle. The main contents of this femoral triangle are three best friends in the body. What are they?
Nerve, artery, vein.
Okay. Femoral nerve, femoral artery, and femoral vein. Van structures. V-A-N. Van structures. Like when you observe these things also, in the diagram, see from medial to lateral aspect, you can see these structures. Van, V-A-N. Vein, artery, and nerve. The femoral vein, femoral artery, and femoral nerve. Now, apart from this, we see inguinal group of lymph nodes over here. This inguinal group of lymph nodes, they are divided into two groups, superficial group and deep group. Superficial group are seen in the superficial fascia only, whereas the deep group are seen deeper and close to this great vessels and close to this great vessels. Apart from these three main structures, we see another few structures also, like this. Here where I am focusing the cursor, lateral femoral cutaneous nerve or lateral cutaneous nerve. Lateral cutaneous nerve of thigh. Next, Along with this, another thing also which is seen in front of the artery, that is genital branch of this genitofemoral nerve. Genital branch of genitofemoral nerve. So these are the contents of the femoral triangle. Main contents are three structures: vein, artery, and nerve. Apart from that, we see other structures like lateral cutaneous nerve of thigh and genital branch of genitofemoral nerve. Now, along with this, we see this femoral group of lymph nodes, inguinal group of lymph nodes. This inguinal group of lymph nodes, they are divided into two groups: superficial group and deep group. Superficial group, they are seen in the superficial fascia and they are arranged like a letter T. They are arranged like a letter T. This superficial group of lymph nodes, it is asked as a short answer for 3 marks. Again, at the last of this class, I will show you a diagram from the internet and I will say about the superficial group of inguinal lymph nodes. Like that, the deep group of lymph nodes, they are seen closer to just the great vessels. So these are the contents of this femoral triangle. Now, what are the contents of the femoral triangle? What are the contents of the femoral triangle?
Vein, artery, nerve.
Okay. Apart from these big structures, inguinal group of lymph nodes. Next, two small nerves. Okay, these lymph nodes are divided into superficial inguinal lymph nodes and deep group of nodes. Apart from this, we see two small nerves. What are they? One is seen on the lateral aspect.
Lateral cutaneous nerve.
Lateral cutaneous nerve of thigh and genital branch of genitofemoral nerve. So these are the structures we see in the femoral triangle. Now we'll see the details of these structures. First, femoral artery. This femoral artery, here in the diagram, you can see it in red colored one. It is continuation of external iliac artery. This external iliac artery enters the upper thigh below the inguinal ligament, exactly near the mid-inguinal point. It enters the upper thigh or into this femoral triangle exactly near the mid-inguinal point and below the inguinal ligament. And this femoral artery, it runs downwards in the femoral triangle up to the apex of the femoral triangle. See, where I am focusing the cursor, you can see, track out this entire femoral artery. Runs downwards in the femoral triangle up to the apex of the femoral triangle. And from there, it enters into the adductor canal, passes through the adductor canal, and in the lower part of the adductor canal, there will be a bigger opening called as hiatus magnus, which is seen in the adductor magnus muscle. And it passes through that hiatus magnus and goes to the posterior aspect into the popliteal fossa. And from there, it is called as popliteal artery. Am I clear regarding the femoral artery? I said entire course of the femoral artery. Am I clear regarding it? Okay, people are showing this thumb again, saying that it's okay. Now, this femoral artery, in this femoral triangle, it gives 3 superficial branches and 3 deep branches. In the diagram, you can see that. In this femoral artery, in this femoral triangle, it gives 3 superficial branches and 3 deep branches. Like coming to the superficial branches, see here, superficial branches, first one I will show you, where I am focusing the cursor. They are superficial external pudenda. Next, superficial epigastric, which will be running upwards towards the gastric area. And the one which will be running laterally towards the anterior superior iliac spine, it is the superficial circumflex iliac. This one. They are running in 3 directions. One is running in the medial direction towards this genital organs, superficial external pudendal artery. The one which is running upwards towards the abdomen is superficial epigastric. The one which is running laterally towards the iliac crust is superficial circumflex iliac. They are the superficial branches. Coming to the deep branches. Deep branches are the deep circumflex iliac, profunda femoris, and descending genicular branches. Right. This profunda femoris artery is a bigger branch when compared with all the branches of the femoral artery. Femoral artery is giving how many branches in the femoral triangle? In the previous slide I said about that. 6 branches. Right, 6 branches, 3 superficial and 3 deep. What are the superficial? What are the superficial branches?
Superficial epigastric,
Right.
superficial circumflex
iliac, superficial external pudendal. Now what are the deep branches? Deep circumflex iliac, profunda femoris, and descending genicular branches. See this femoral artery in femoral triangle also, it is asked as a short answer. So if it is asked as a short answer, you have to write entire these 3-4 slides. Like if you want, you can take a screenshot of this slide first one, where you can say that it is kind of femoral artery is continuation of external iliac artery which enters the upper thigh or into the femoral triangle through the mid-inguinal point, below the mid-inguinal point, and it runs in the triangle, runs downwards up to the apex of the triangle, where from there it enters into the adductor canal, passes in the adductor canal, goes up to a big opening in the lower part of the adductor canal called as hiatus magnus. From there, it is called as popliteal artery. This femoral artery gives 6 branches in the femoral triangle. 3 are superficial and 3 are deep. The superficial branches are superficial external pudendal, so which goes towards the genital organs medially. Superficial epigastric, which runs upwards towards the abdomen region. And superficial circumflex iliac, which runs laterally towards the iliac crest region. Now the deep branches are deep circumflex iliac artery. Name itself is saying deep circumflex iliac. Sorry. The deep branches, regarding the deep branches, it is deep external pudendal. After that, this profunda femoris and descending genicular branches. So these are the 6 branches. Now, after this femoral artery, coming to this, here in the diagram, here also you can see these are the genicular branches which are supplying the areas in this adductor magnus. And this is the last one called as adductor magnus hiatus, through which this femoral artery will be passing backwards and it enters the popliteal fossa over here, and it is called as popliteal artery. Now coming to the next one, femoral vein. This femoral vein, like a this femoral vein, it enters this femoral triangle from the apex of the triangle and ascends upwards and it shifts to the medial side of the artery and continues as external iliac vein above the inguinal ligament. Here in the femoral triangle, we see mainly the tributaries like the profunda femoris vein, great Stephanus vein, which is coming from the lower aspect and it is entering into the femoral vein through this cribriform opening or Stephanus opening. So after femoral vein, another important thing, this is a short answer, femoral sheath. This femoral sheath is nothing but the fascia which is covering these great vessels, mainly the artery and vein in the upper 4 centimeters of the femoral triangle below the inguinal. Am I clear regarding the femoral sheath? Again, I will say, it is nothing but the fascia which is in a shape of a funnel and covers the great vessels. That means the artery and vein. It doesn't cover the nerve. Remember, it covers only artery and vein. And it covers only upper 4 centimeters of this artery and vein. And regarding the shape of it, it is funnel shape. And this femoral sheath, it has an anterior wall and a posterior wall. The anterior wall is formed by fascia transversalis and the posterior wall is formed by fascia iliaca. Again, I'll show you this diagram. Just give me a second, I'll show you just now only after this slide. Yes. So now we are talking about this femoral sheath. I'll show you this diagram also. Like the anterior wall of this femoral sheath is formed by fascia transversalis and the posterior wall is formed by fascia iliaca. Here in this diagram, you can see this femoral sheath. Like this lower part, this is the anterior abdominal wall. Anterior abdominal wall consists of 3 muscles: external oblique, internal oblique, and transverse abdominis. So the fascia which is covering the posterior aspect of transverse abdominis is called as fascia transversalis. It runs downwards. See this line over here. It runs downwards and enters the upper thigh region. So this is forming the anterior wall of this femoral sheath. Like that. Coming to the posterior wall of femoral sheath. Posteriorly, we are seeing iliacus muscle, which is forming the floor of this femoral triangle. The fascia which is covering this iliacus is called as fascia iliaca. This also runs downwards into the femoral triangle. It is forming the posterior wall of this femoral sheath called as fascia iliaca. Now, is it clear by showing this diagram? The anterior wall and posterior wall of femoral sheath. Anterior wall of femoral sheath is formed by fascia transversalis and posterior wall of this femoral sheath is formed by fascia iliaca. They run downwards up to the upper 4 centimeters in the femoral triangle, and these walls, the anterior wall and posterior wall, they merge with the superficial layer of these great vessels. Next thing, in this diagram, you can see this external oblique also. In the lower part, it forms an aponeurosis, and this aponeurosis is thickened and it is folded on itself towards the inner aspect to form this inguinal ligament. While saying about inguinal ligament, I said this point. Here in this diagram, you can clearly see this external oblique aponeurosis. In the lower part, it is thickened and it is folded on itself to form this inguinal ligament. Now, coming to the functions of this femoral sheath. It allows femoral vessels to glide freely beneath the inguinal ligament during hip movement. And when you observe this femoral sheath, it is divided into 3 compartments by 2 septa. It is divided into 3 compartments by 2 septa. The medialmost compartment is for a lymph node. This lymph node is called as lymph node of Cloquet or Rosenmuller. And this medialmost compartment is called as femoral ring. Sorry, the medialmost compartment is called as femoral canal. The medialmost compartment of this femoral sheath is called as this compartment where the lymph node of Cloquet or Rosenmuller is there. It is called as femoral canal. And the intermediate compartment is for the vein and the lateral compartment is for the artery. Now, after this we see the femoral nerve over here. This femoral nerve, again they'll be dealing with a separate class for this. I will not go into the details of this femoral nerve. We will not see this femoral nerve in this femoral sheath. It is out of the femoral sheath and it is one of the contents of the femoral triangle. Now coming to the applied anatomy of this region. So, applied anatomy. Can anyone say the applied anatomy of this femoral triangle? Anyone? Of femoral tapping. Then I have focused the diagram next. What is femoral tapping? Anyone? Usually when I speak taking classes, 3 people are saying this. One is Monica and some other boys also saying answers. So these two. What is femoral triangle? Am I audible? Am I audible for everyone? At least say something yes or no or you
Yes,
this.
sir. Audible, sir.
Okay. Now what is femoral triangle?
Yes, sir.
Sorry, what is femoral tapping? Usually, in severe anemic patients, usually if a patient is there, from which blood vessel usually you draw blood for investigations? In the upper limb, we have read about it. In the upper limb, we have read about it. Median cubital vein will be taken. What? Someone said brachial artery or something. Who's that? Simple. Whenever you are taking blood from,
vein.
you know,
Puncture of femoral vein.
puncture of femoral vein. Okay, I'll come to this. You are closer to that, I'll come to this. Usually, whenever you are drawing blood for investigations, what is the preferred vein? Upper limb lo chadukunnam kadamma.
Medial cubital vein.
Right.
Medial cubital vein.
Medial cubital vein. So whenever you are drawing blood for investigations, usually you prefer medial cubital vein to withdraw blood. But in severe anemic patients, what happens is usually veins will be in a collapsed stage. Then you will not get this medial cubital vein, or sometimes you observe this dorsum of this wrist joint, dorsum of the hand, where you will see these venous arches also. There also you can't find any veins to withdraw blood. In such situations, this femoral tapping will be helpful. Usually, you can feel the femoral pulse. Like already these 3 structures are there in the femoral triangle. What are they? Best friends? Vein, artery, and nerve. Nerve will be on the lateral aspect, isn't it? Vein will be on the medial aspect, whereas artery is in the center. Am I right?
Yes, sir.
VAN. Nerve will be on the lateral aspect. Artery will be in the center. So femoral pulse can be felt. So once keep your 3 fingers. See in this diagram, you can see that the person who is withdrawing the blood, he kept his fingers over there. He's feeling the femoral pulse first. After that, medial to that will be the vein. So medial to these fingers, he is inserting this syringe over there and he's withdrawing blood for investigations. So in case of severe anemia where you cannot withdraw blood from other veins and our veins are in collapsed state, in such situation you can withdraw blood from this femoral vein. It is called as femoral tapping. Next, femoral pulse. Already just now I said femoral pulse can be felt in this groin region. Next, femoral hernias. These femoral hernias are common in females because of wider pelvis and usually the abdominal contents will be pushed into this upper thigh region through this femoral canal, which is seen in the femoral sheath. Femoral sheath consists of 3 compartments. What are they? Medialmost is femoral canal. And what are the remaining 2? One is for artery and another is for vein. So, this contents of the intestine, usually they pass through this femoral canal in females, which will be seen as a swelling in this inguinal region. It is called as femoral hernia. So this is the applied anatomy of this. So this is about the femoral triangle. Any doubts regarding the femoral triangle? Any doubts regarding the femoral triangle? So with this, I am completing this femoral triangle. And thank you.
Thank you.
Okay.
Thank you, sir.